Good morning. My name is John Blacher. I'm 71 years old, and today is a big day. I'm going to be heading to Royal Victoria Hospital in a short while to have a bilateral hip replacement. That means I'm going to do both hips at the same time. Start on the left, finish with the right. My orthopedic surgeon is Dr. Vora. He specializes in an anterior approach to accessing the hip joint. That approach tends to have fewer complications, certainly at the front end. He doesn't have to cut any muscle or tendon to gain access to the hip joint. So that's a bonus. There is a slightly higher risk of infection with that particular type of entry approach, but the infection increase percentage is very, very minimal. That being said, there are some precautions that you have to take and instructions that the hospital and your surgeon might give you prior to the surgery. I am scheduled to spend at least one night in the hospital because I'm having a bilateral hip replacement. They have booked up to 3 nights if I need that extra length of time. Hopefully I'll be out on Tuesday, surgery being performed on Monday. There are some things that you should know regarding your pre-op preparation. One is that you are instructed to have a shower, either the night before or the morning of. That's important, but you also are going to be given some antiseptic type sponge in a sealed container. These sponges, once you've had your shower and you've towel dried, are used to completely weight down your body from the waist down to your toes. Both sides, all parts. You do that at night after the shower, and then they're requesting, in my case, that I do it again in the morning, but not have a shower in the morning. Just do the sponge bath. The other thing that's important is they've asked that no consumption of beer or alcohol at least 12 hours prior to the surgery. And if you're doing hard drugs, cocaine or other hard drugs, they're requesting you do not do those at least 48 hours prior to surgery. Now, about the shower. I am going to be allowed to shower, obviously, pre-surgery, but following surgery, I'll also be able to shower. Now, they're going to put a waterproof dressing on each wound. That dressing will last me 7 days. They've requested that I purchase the exact identical dressing to reapply it after 7 days, and that'll carry me through until I have the staples and or stitches removed 14 days later. And 1 day prior to having the stitches removed and the staples removed, I'm not sure which they're going to use to close the wound, I will start my physiotherapy, and then I have a scheduled doctor's visit. So the important thing going into surgery is to follow the instructions they provide, because they could actually cancel the surgery if you don't. Instructions like not to consume any alcohol, including beer or wine, to not consume marijuana at least 12 hours in advance, but also not to consume hard substance foods for at least 12 hours in advance of surgery. If you consume food, you're just increasing the risk of vomiting and presenting complications to the anesthesiologist and the surgical team on your day of surgery. So no foods. They're recommending simply clear beverages, water, juices. Some juices are restricted, so I'll try to provide a list of those. I'm supposed to be able to have a black coffee with a little bit of sugar. I don't take sugar, so I'm going to stick to, I think, just water. Play it safe. And that's about it. So I'm going to be allowed to have my shower. I'm going to put the, I guess it's a disinfectant type solution that kills surface bacteria that might be on your skin. I'm going to do that thoroughly from waist to toe. And then once that's dried, I'll try to get some sleep. And then the next morning, first thing in the morning, I'll apply a second dose of that antiseptic solution, and then get dressed and head to the hospital. So signing off, I'm hoping these videos provide some assistance, and I do want to give a shout out to all my friends who have sent me well wishes and are praying for me that this all goes according to plan. So see you later.